Well, welcome everybody. Thanks for being here again. David starts with the Cooperative Strategies and our weekly series here. We are talking today with Dr. Kathleen Minke from the National Association of School Psychologists. Really glad to have her here and connecting the dots all back through. Mo from last week said, hey, you should really speak to Kathleen back in, gosh, when was it? Last fall sometime. And so connected the dots and gracefully she said yes. And so we're looking forward to the time today on what is a very timely topic, was a timely topic then, and is even more so now, given the fact that there are monies that have come out specifically to address what has been deemed learning loss. And Dr. Minke is going to probe that concept a bit with us today, poke on it a little bit, and so sort of like to talk about some expectations and some approaches there to look at you can't do this alone approach and what they're looking at moving the village to address the needs, academic, social, emotional, and doing so in an effective way. And knowing sort of the framing up here, I'm going to step out of the way, is Dr. Minke is looking, when in the setup here, just said, look, for our audience, for these purposes, what we're looking for is what are some of those key touch points that can define an effective program and effective response, knowing that the actual tactical details of many of these interventions will be done in our districts by those experts there in the specifics of the field. And what we're looking for is for those of us who don't have that technical training in the field of psychology and intervention to know what are the key foundations of a successful and well thought out program, so that when CBOs and CFOs and operating officers in team are looking at implementing and scaling these interventions, they know what to look for, at least broadly speaking. So I'm going to get out of the way. Kathleen, welcome. Thanks you for being here.
Thank you, David. Thank you for inviting me. Yeah, I just want to, as David and I talked, we wanted to give you guys a lot of time to ask questions and have conversation about these issues. And so I'm going to quickly run through just a little bit of background and a little bit of information about mental health, and then really just talk about a couple of key takeaways for you to think about. And so just as an introduction, I am a school psychologist by training and avocation. I have worked in public schools in several states, Virginia, Indiana, Delaware. So I feel like I have a little bit of understanding of what y'all are trying to accomplish as we begin moving back to the opening of schools. So these data that are right here, they come from the Anna E. Casey Foundation. The Kids Count Data Center it's a really useful publication they put out every year. And this goes through about 2018, it was published in 2020. And at that time, things were looking like pretty good. Things were starting to improve with respect to kids' well-being. Although even at this time, we know that minoritized communities, kids in minoritized communities were faring worse, particularly with respect to their educational opportunities. But we thought we were doing okay. And then we all know what happened next. So I imagine that, you guys are seeing as you move towards school reopening, a lot of these kinds of issues. We know that kids are resilient, but we also know that there's going to be increases in mental health concerns as we return to school. Mm-hmm. And we know that everyone's day-to-day life was affected in some way by the pandemic. So you can advance one there for me, David. Fortunately, sorry, I wasn't keeping up. Everybody's life was affected in some way. Everybody experienced some degree of stress. But, and again, I like metaphors, but this is one of my favorite ones, that, we've all been in the same storm, but we definitely have not all been in the same boat. And some of us have had a yacht with lots of resources, lots of supports. Others of us had a leaky rowboat without a lot of capacity to take on any other additional stressors. And yet that's what the pandemic brought us. And as the pandemic was unfolding, we were also experiencing a second pandemic in a lot of ways around a greater recognition of overt racism and the associated trauma for kids who are in minoritized communities. And so, again, as district leaders, you have to start thinking about what was happening in our community, what was really kind of the key to our students, our staffs, and the things that were happening. So that leads me to our first takeaway. If you go ahead, that you really are going to want to assess and not assume. And at every level of your planning, thinking about what was specific to our community, to our school district, to our school, that will help us understand what we need to be doing. And importantly, assessment in this context does not mean testing. I'm really worried about this notion of learning loss, and somehow we're going to be able to assess our way and test our way out of this thing. But what we're going to need when kids start coming back to school is some time. And kids need to reconnect to the idea of schooling. I mean, for us, this last year has, depending on your age, it's a much smaller percentage of your life than it is to a 10-year-old. And so kids really have to have some time to reconnect with their peers, to reconnect with the adults in the school, to feel comfortable and relearn routines and expectations and all of those things. And so we really don't want to start off by plunking everybody in a desk and giving them some tests. And I think it is important to really kind of interrogate this notion of learning loss. It's kind of a construct. I mean, what is loss compared to what? We set arbitrary standards about what a kid ought to know at the end of third grade, or what they ought to know as they're entering high school. And again, the standards are somewhat arbitrary, and they were not designed for these kinds of circumstances that we have experienced. And so I think that, again, we have to be considering what did the kids in our community actually experience, and what does that mean for where they are academically and social, emotionally, and behaviorally. Some kids actually thrived while they were out of school. Kids that maybe had a lot of social anxiety, kids that didn't feel really kind of connected in their schools, or really, like it was a safe or good place for them, may have actually done pretty well. But we know that lots of kids did not have the same kinds of access. They didn't have access to broadband, for example, in many communities. For kids that lived in homes where you have four folks and one computer, that kind of opportunity to learn or opportunity to participate in instruction may have actually been pretty difficult. And so again, the notion here is that you have to be thinking about what were the instructional opportunities for kids in our district and in our school, recognizing that those may be very different even within a single school. So the graphic the little picture that you see here of this mental health quality guide gives you an opportunity to look at needs assessment and resource mapping. And so one of the sort of the big strategies that you can begin with is looking at what do we need, first of all, what are people telling us that they need in order to be successful, and then what do we have? And where there's differences between what we need and what we have, those are the gaps that you're going to be trying to fill. And this resource actually does a nice job of giving you some guidance with how to do resource mapping and needs assessment. And I think it's important as you do this that you think about how are we using the resources that we do have? Are we using them as effectively as we possibly can? And with the within the mental health arena, are school counselors spending a huge proportion of their time scheduling kids into classes? Is that the most effective use of their mental health skills? With your school psychologists, and school psychologists will talk about, I spend a lot of time scheduling meetings, scheduling IEP meetings, or scheduling this and that and the next thing. Is that the most efficient use of the time? Or is there someone else who may be able to handle those kind of administrative tasks while you free up a little bit of time for your school psychologist to be engaged in mental health tasks? And again, that's just an important way to think about the resources that you actually do identify in your resource mapping. So on our website, if you just go ahead one there for me, David, on our website, we have our COVID-19 Resource Center, and most of the resources that are there are available to the public. And so you can find information for parents, information for educators that you may find useful as you're thinking about how do we begin thinking about our reopening plans. A second resource that we have, David, if you advance for me, is this one is newly published, Ready to Learn, Empowered to Teach. And here, this resource really focuses on a whole child approach to policy and to practice, which, as we know, as we move out of the pandemic, thinking about children not just as learners, but also as whole human beings who have experienced a pretty unprecedented set of circumstances is really going to be important as we move forward. So again, so kind of going into the next sort of takeaway for you is to really look for what's working. If you could move us ahead there one more, David. It is our nature when we're faced with problems is to examine that problem, to try to unpack that problem, and to look for the solutions. And one of the things that is easy to overlook is that the solutions are most likely embedded in what is going well, even a little bit, and even some of the time. And so as we're looking at how are we going to address these issues that we're identifying, what are the strengths and resources that your people have that they are bringing to the situation? It's really going to be a helpful way to think about it. And even more critically, as we start thinking about problems and their solutions, we sometimes overlook the expertise of those who are closest to the problems that we're trying to solve. And so really asking students can be very, very powerful consultants on their own behavior when we ask them the right questions and really listen to what they tell us. And this is going to be especially important as we begin really trying to more effectively and significantly attack issues of inequity, of systemic racism, because kids are going to be able to tell you much more accurately than adults about what it is like to be a student of color in your building and what that means for their learning. And so really finding ways to talk to kids and ask them what they think about things is important. Families also can be a really important source of information. As you set up problem-solving teams or whatever kinds of teams that you are setting up, really consider asking families, parents to participate in those. I worked in a school years ago now where we were doing positive behavior interventions and supports, and we had on our school-wide team, we had a couple of parents. And the school was struggling with tardiness, and kids were showing up anywhere from 8:15 to 8:45. And the parents on the team raised their hand and said, well, do parents know what time school starts? And of course, all the educators said, well, of course they do. We send that home in the newsletter and with this on the website, and everybody knows what time school starts. And so they thought, well, wait a minute, let's think about this for a minute. And so they did a quick and fun little survey of parents. And lo and behold, parents thought school started between 8:15 and 8:45. So it wasn't very surprising that they were showing up at those times. So again, by asking the folks who are closest to the challenges, you can sometimes get better answers that will guide you. I think as we start thinking about our staff and our teachers, really trying to pay attention to what kind of supports, professional development, emotional care is going to be available for the adults based on their own self-reported needs. We know that there's going to be a lot of pressure on educators to recognize signs of anxiety, depression, trauma in students. They're going to be managing the ongoing challenges in their own families. They may have experienced significant losses in their families. And so we want to be thinking about providing trauma-informed practices and training on those kinds of practices, as well as robust protocols for identifying students in need, But we also have to be thinking about how do we build into the regular day, into the regular schedule, the opportunity for teachers and educators to engage in effective kinds of self-care. If you're thinking about this notion of looking for what's working, ask your school psychologist what they know about strengths-based intervention, positive psychology, solution-oriented approaches to counseling and intervention, and they can help you with this. Which leads me to my next takeaway, which is essentially don't do this alone. this is if there was ever a time for collaboration and partnering, this is that time. And we don't want individual principals or individual school psychologists, or even at the district level, one person sort of in charge of trying to figure this stuff out. There's going to be physical health, mental health, increased need for flexibility and staffing, all of these things. And the effects of the pandemic are going to be around us for a while. And so really effective district leadership, I think, is needed to ensure that you have established a multi-tiered system of support that is addressing both academic and emotional kinds of aspects of children's health and adults' health. And I know, you go ahead there, David. I know that you guys had a talk on MTSS, but I think, as a school psychologist, I just always have to have a triangle in every presentation. It's really important. But as you think about your multi-tiered system of support, there's a couple things about this graphic that I think are important to think about. And one is that kids that are struggling academically are going to have social, emotional, and behavioral problems. Kids who have social, emotional, and behavioral problems are going to struggle academically. So we want to think about how do we integrate these supports that we have. It's the same kids. So you really want to make sure that you're paying attention to both halves of the educational experience. Another thing to notice on this graphic is that there's sort of this gradation. It's not like kids are one level or another level, but you want to think about supports being at increasing intensity for those kids that need it. And every kid still is receiving high quality core instruction or those positive preventive services, no matter how far up the triangle that they may be, although they will be getting additional supports as well. And then the last thing to sort of notice from this graphic is the emphasis on systems. This is not about building an individual intervention plan or about having one particular curriculum that you think is important. All of those things matter, but what you really want to be thinking about is the system. How are we building this thing so that kids are getting the supports that they need when they need them and are moving easily among those levels of support? So sort of going forward, one way to help you is to really think about effective community partnerships, school community partnerships. And the key word there is effective. You really want to be selective and think about which community partners have shared goals, complementary expertise to what you have and what you need, and a willingness to adapt and support school-based kinds of realities. I know that I've worked sort of on both sides of the fence. And when, community partners will sometimes, come into the school and they feel like, oh, the school is so rigid, they don't provide us with the space that we need, and they don't provide us with the supports that we need, when in fact that's really challenging in the school building. And school people, for their part, sometimes feel like, well, they don't understand us. And so trying to really be mindful of building partnerships that are based on your needs assessment, based on your resource map, so that it fits, is really important. I struggled to remember the author of this. I apologize, I can't give him or her credit, but it was a book that I read one time about community partnerships, and it talked about you don't want to be a Christmas tree school. And in a Christmas tree school, you have multiple innovations that decorate the school, but there's no real planning. There's no coordination among those innovations and among those interventions, and therefore they don't work as effectively as they could. So we put out just this week, in fact, you go ahead, David, a resource that we developed, NASP developed with the National Center for School Mental Health, and it is also available on our website. I think David may have distributed it to some folks as well. But it really outlines some of the things to think about in how to build effective community partnerships. And although in this particular document, the focus is on mental health partnerships, other kinds of partnerships, the same kinds of principles apply. So if you're thinking about your, the relationship with a school-based health center, for example, or with your school safety personnel, law enforcement, that kind of thing, the same sorts of principles in building partnerships can apply. One of the key elements to this, and you go ahead, is a memorandum of understanding. And in this document, there's some key features of MOUs are outlined. But I really truly believe that if you do not have a well-developed, carefully crafted, written memorandum of understanding with each of your partners, you're opening yourself up for challenges and difficulties. And so, kind of the quickest way of summarizing it is you want to be really clear about the money. You want to be really clear about information, who gets shared with, who gets shared to whom, when, what, under what circumstances, and then finally, who makes what decisions. And if you've got those three things laid out in a solid MOU, then you can you'll know what to do when wrinkles inevitably happen in the partnership. And so I also have to do this particular slide. If you can go ahead, David, I'm sneaking in a fourth takeaway here, which is this is our practice model. This is what school psychologists know how to do and know how to be able to help you. And so as you're trying to build systems of support, as you're trying to build that long-term recovery plan, let your school psychologist help you in gathering and analyzing data, in helping you understand the supports that you have and the supports that you need, and really just sort of assisting in that adjustment process as you move forward. So I kind of raced through that a little bit more quickly than I had intended, but that's sometimes I get excited and that's what I do. So I guess, we have time. I just really would like to hear from you all and what your thinking and ideas are and questions, and have a conversation.
Yeah, thank you, Kathleen. Folks, feel free to unmute here in a minute and ask your questions, or type them in the chat, whatever works for you. I wanted to jump right in with one of the first ones. Is in the beginning, you were, questioning. You were just cautioning against test-based assessment, as you've just got back from the pandemic. Great to see you. Let's do some standardized tests, right? And so the dehumanizing element of that, as well as was what I inferred as part of the challenge there, is in the need being the rehumanization and socialization aspects and so forth. What I heard you pointing to was that we need to define what the goals actually are before we say that there's been loss. Now, clearly there has been a lack of the same kind of instruction at the same pace and the same depth for many children. Some have thrived, but for all intents and purposes, it certainly seems that is the fewer percentage of folks. And what I heard you, and we kind of previewed this a little bit about some of the conversation we've had earlier on this webinar about less is more when it comes to some of our standards as well, that perhaps we are trying to shove too many content standards down into the brains of all of our kids at different levels every year. And do you recommend sort of taking a step back before we get into designing these programs and recalibrating what we think the academic outcomes should be, and then organizing our responses, or is that too broad?
Well, and some of it I think is somewhat developmental. It depends a little bit on where you are, but in an elementary school, for example, again, you're going to be treating this like you would a normal first 6 weeks of schools in some ways, where you're actually really spending a good bit of time reteaching behavioral expectations, helping people connect with one another, helping every kid feel like they belong at the school, making sure that every kid at the school has an adult that they feel comfortable talking to. Those kinds of things are really important. And while you're doing that, you can actually be delivering high quality instruction. And so we know that, when we're teaching reading, for example, or math, that you can easily progress monitor how things are going without there being a standardized test, without there being, we're going to see where we are relative to third grade standards. You can start applying high quality instruction, doing good progress monitoring, and really paying attention to those kids that are moving along the pathway the way that you expect, and those kids that maybe are struggling more. And for those kids, what do we need to begin to do differently? For many of them, part of what we need to be doing differently may have to do with going back to that reconnection process. What I'm concerned about, again, for probably more for younger kids than secondary kids, is that we don't assume that every challenge that a child is demonstrating as they come back into school, that child should be evaluated for special education services, that child has a learning disability, because we know that the pandemic is going to be impacting, kind of kids' abilities to sort of just kind of get back in the swing of things, differentially, depending on what they've experienced. And so a focus on high quality instruction is never going to set you down the wrong path. And but I think a little bit of grace on whether or not we want to be thinking about these end of year standards as being essential in this particular school
year. Since we're on this theme right here, end of year standards from a school psychologist perspective, from your perspective as a school psychologist, what would be a social emotional standard that you would want to be a focus? And does it change developmentally, just sort of in broad strokes, elementary, middle,
high? Yeah. Well, again, one of the things that I think is invariant across the developmental levels is that every kid needs to feel safe at school, and every kid needs to feel connected to at least somebody at that school. Ideally, you want the kid to have at least one good peer relationship. It's not necessary that every kid's the most popular kid at school, but having one good friend actually has been shown to be pretty protective with respect to social emotional development as you move forward. So I would be thinking about, again, across the grade levels, does every kid feel safe here, and does every kid have somebody that they can talk to? I think when you were talking about the notion of less is more, I think particularly again at the elementary grades, focusing on sort of those core skills of reading and math and problem solving is probably where you want to focus your energy. And there may be some content issues that get perhaps pushed off a little bit as you do that. But if you're teaching that notion of critical thinking and problem solving and being curious about things, that's kids will niche pick their way into the academic content as they move forward. At the secondary level, dealing more with adolescents, I do think it's important to consider, at adolescence, kids are a little bit more aware of sort of what they may have lost. So if you have, rising seniors that did not have the opportunity to participate in varsity sports the way that they expected to, or, that maybe they are putting pressure on themselves and feeling like, I'm not going to get into the college that I want to get into because I missed all of this schooling. And those kids, I think, are going to need a little bit more support in, kind of taking a step back and being able to say, okay, let's let's look at what you did. And this sort of goes back to the strength-based notion that I was talking about a little bit ago. Is that the kids, these kids and these teachers, by the way, have done something that nobody in our lifetimes has had to do. And they did it. What's the evidence that they did it? They're standing here in front of you, and they're managing at some level to be successful. So, really trying to help kids recognize their own strengths, their own resources, the ways in which they have managed this really unmanageable situation will go a long way to keeping them on a positive trajectory and not being necessarily overly focused on what didn't happen, but on what they did well and what's coming next.
Okay. Are you, thank you. Are you seeing the chat, or do you want me to read the questions that come in?
I actually am not seeing the chat.
Okay. So one of the questions that came in was, we're trying to determine how many students will return next year from a facility and staffing perspective. We're thinking about requiring families to apply to be in a virtual setting next year with the assumption that everybody should be back in person. What is some guidance on how we should approach this application and discussion with families for the next year, especially for those students who have not been successful in the virtual environment this past year?
Yeah, that's a tough one. I like the notion that you're planning to ask people what they think and what they need. I think that is important. There are lots of reasons why some kids may not have been successful in the virtual environment during the pandemic that may or may not continue as we move forward. But I do think we have to be respectful of families' fears, and of families' individual situations. If they are, living in a family situation where, there are members of the family who cannot be immunized, they may be really quite fearful of sending their kids to school. And so I think asking those questions about, I would be asking things like, what supports do you need in order to be successful if you're going to keep your child, in the virtual environment? And that could be technical support, it could be actual, equipment support, or it may be emotional and behavioral kinds of supports that families need. And then I might also ask a question about what would need to be different for you to feel comfortable having your child come back to school. So you could begin to, you could get some information from families about what's sort of holding them back. Because again, I think, generally speaking, for most kids, being in the school environment is a healthy and important place for them to be. The social emotional learning that happens, the emotion regulation skills they develop, the ability to kind of get along with others and problem solve their own social situations. Really important stuff that happens in groups at school. So I would want to know from families what would need to be in place at school for you to feel comfortable having your child come back. And that I think could help guide you on what supports to provide.
And maybe sharing some of the things that you are doing, Kathleen, like these are the steps we've taken. Like, Debbie, who's asking the question, personally installed a bunch of indoor air filtration systems in the school, right? Just got it done, right? So do you think like that? Do you think there needs to be sort of a general, these are the steps we've taken, what else would it help?
Yeah, I think that would be really helpful because, and again, I think remembering that not every family receives information in the same way. So again, sort of like in my tardiness example, you may feel like you've communicated this information, but it may not have actually gotten into a parent's, way of thinking. Especially again, we have to, remember that these families have been under enormous stress, as have the teachers, as have the kids. And so their capacity, the amount of capacity they have to take in new information might be a little bit more limited than under more relaxed circumstances. And so I think that looking for those multiple ways of communicating, not just what we send home in newsletters, but short videos that you could put on the school's website that may show here are the things that we are doing that that are designed to make our school healthy and safe for your child. And language issues are also a big part of this. If you have multiple languages in your school.
Sure. Mm-hmm. Okay. Thank you for the question, Debbie. Others might have a question, comment? If not, I got a whole bag of them up my sleeve, but I'm going to get out of the airways for a minute. Okay, well, I'll keep rolling. And as you put them in the chat, if you could, or just raise your hand virtually or what have you. But, we have this 20% set aside that's coming in with these ARP funds, stimulus funds. And this is on a Council of Great City Schools webinar in the past couple of days. And districts are, of course, making their plans for that right now. The money they haven't received it, but it's coming. It's coming here in the coming month or two, should be there by June, according to how we read the legislation. What kind of resources are out there for COOs, CBOs to share with, and school psychologists for that matter, mental health professionals, to share with the academic teams who are in charge of creating these interventions and scaling them up to help infuse that we need to get from A to B on content with some of these, more crucial, I trade my bias there, right there. These very crucial sort of social, emotional, belonging, safety. It's more than, this is your profession. It's obviously much more than simply intending to make a kid feel safe. There's strategy, there's tactic, there's practice, there's research. Where can we go to get some information to help infuse those key strategies to help students feel belong and safe, and in effective relationships with adults and peers through these interventions that are going to be done at a scale that has never been done before?
Yeah, I think, one of the words that you use, I think, is most important is the word infuse, that we think about what are the social, emotional, behavioral supports that kids need, and we don't make them a class, we don't just have a class
It's not a new health class.
Right.
Today we're going to second graders.
For the next 20 minutes, we're going to talk about feelings. That's not really very effective. But there are good social emotional curricula, particularly for younger kids. If you go to, I'm not going to get this right. It's CASEL, CASEL. I think it's a .org. But they, there we go. Thank you. I did see that one pop up. And they have just a ton of resources. They have evaluated resources, curricula that have some evidence to support them, and that those are designed to be infused into the regular curriculum, so that you can, really be teaching kids the skills that you want them to demonstrate as part of the regular learning environment. And I think that, again, not everything is free. Information is not always free. And you may need to have some training for some of your mental health staff, to implement some of these curricula. So that would be a good use of some of those funds that would actually sustain. It's a professional development. It's going to sustain as long as you manage to hold on to your personnel.
Yeah, that's actually one of the things that's popped up quite a bit in conversations about that I've been party to when using these funds on professional development. Well, what professional development? For what ends? How do we, questions about how you set up, these short-term funds that'll be here for a few years without creating a funding cliff and hiring a bunch of, the response could be, we're going to hire 12 new school psychologists and 12 new intervention specialists, and then in 3 years from now, we're going to have to let them all go.
Yeah. Right. And that's not a great model.
That's not a
And
great
if you can find those 12 school psychologists, that'll be a miracle, because one of the things that we have is a pretty serious workforce shortage that we're working on. But I do think that investing in your people, investing in the people that you have, and investing in their skills is important. Investing in your physical plant so that that your building is as healthy and safe as it can be, and that makes sense. I think with respect to the safety issues, of course, we've already seen some school shootings in the last little while since kids have been back in school, and I do think it's important that from a facilities and administrative standpoint, that you think carefully about the physical plan of the building, but that you also have to bear in mind that making your school a fortress is not going to accomplish the physical and psychological safety that kids need.
No.
And so, again, there's just a ton of information out there. And I guess the thing that I would really advocate for is just a mindful and planful process, and that you really examine the pros and cons of particular approaches to having a safe school that it makes that school both physically safe and psychologically safe for all kids. And there is some pretty significant data emerging that not all kids respond in the same way to some of our efforts, and particularly kids who are from minoritized communities or over-policed communities. Law enforcement in school may not be conducive to their feelings of safety, and we just have to grapple with those issues, and we have to be honest about them.
Yeah, absolutely, and had some good conversations seeding that conversation last week with Mo. And elementary to you, but just one of the things that stuck out as you were talking too is this: back when we had our student services folks on, we've had them twice from Jeffco and in Colorado, and they introduced our team to MTSS and sort of these general interventions. What struck me as you set up this pyramid here, and we're talking about the different interventions, that this, come on, mouse, where are you? There you are.
There's that triangle.
There it is. That the baseline universal intervention is not separate and apart from high quality instruction. It's part of it.
Correct.
And that, I think, from a practical standpoint, that's one thing that clicked in your presentation for me today. And so that castle.org site, I heard it has some resources there to help to do that. And it certainly seems like professional development focused on those tier 1 interventions through direct instruction, supporting all of our frontline teachers on some of these basic strategies to consider in their normal teaching is perhaps the foundation of a universal response. Am I overplaying that because I'm a novice? I'm not, but is that?
No, I think you're exactly right. And again, we have teachers get asked to do so much, and
right, sure.
We put so much responsibility on them, but it's not rocket science, really. It's about building relationships with kids. It's about noticing when you want every kid to feel like, if I don't show up at school today, somebody's going to notice. Somebody's actually going to care that I didn't come. And finding ways to communicate that is important. And when we talk about, it's become almost a buzzword kind of a thing, trauma-informed care and that kind of a thing. But there's a lot of there. There's a lot of substance there about, thinking about kids' behavior, when kids are misbehaving, I had a friend once who taught and said, kids don't have behavior problems. Kids' behavior is their attempted solution to their problems. And when you take that as the approach and think of, all behavior is communication. So how can I know what this behavior might mean? And then how can I help this particular kid get their needs met in a way that is more productive for them and less disruptive to everybody else? That's a win, and again, those are skills that I think are teachable and that our frontline educational staff can learn how to do, but it may not be what they learned in their training, and they may not actually sort of conceptualize behavior in quite that same way. And so there's a lot of opportunity for professional development, for folks to learn how to approach kids who come from very diverse backgrounds and whose behavior may be communicating different things.
Yeah, that strikes another theme, Kathleen. And yesterday talking with these folks, folks in charge of facilities for the largest school districts in the country, New York, Broward County, big district, and part of the theme in conversation was that this time last year, there was a general sense of, we have no idea what to do. This is all, everything is novel, everything is crazy, everything is up in the air. And the more experts we've had on this webinar, the more people who really know their craft deeply have said what you've said, which is, and the basic of it, the basics aren't rocket science. When you have an IAQ, an indoor air quality expert, and you say, well, you need to get more fresh air in, and you should have, filters that work. You need to make sure the system that you have works. Because if you have a system that if the system that you installed is working how it should, you're going to be getting pretty good ventilation and decent filtration. And that can do a lot right there. Start there, start with the basics. And with this sense of if I don't show up, somebody's going to miss me, that belonging, like there's a basics there that we need to stick to. And our Jeffco folks helped us as well with pick 2 strategies for each tier of intervention and just do those. Don't try to do 12, do 2, 1, something that works.
Yeah, and do those well, and then assess what, because again, with every intervention, as you move up the triangle, you get more kids responding. And then you can think about, okay, well, who didn't? And what do we need to do differently to catch up another little group of those kids that didn't respond to the things that we already have? And it's like, oh, okay, we'll try that. We'll evaluate it. We'll see how we're doing. And we're going to scoop up another group of kids. And we've got 85% of our kids responding to what we're doing. Who's missing? And so it can be that kind of a planful process. And I know a lot of schools, struggle when they're just sort of starting out with these things. Where do we start? Do we start with the kids who are having the most difficulty, or do we start at that base? And I really think that it's important to start at that base. And the more kids that you are able to meet their needs in that integrated, universal kind of a way, the less resources you have to apply to kids who are struggling.
Yeah, there's lots of good parables and sayings about that.
Well, and I mean, again, and that to me also highlights the intersection or the overlap of social emotional behavioral health and high quality core instruction, because we talk about curriculum casualties, and if we have if we have a curriculum that is not developmentally appropriate for the kids that we are dealing with, kids fail. Well, is that a kid problem, or is it a curriculum problem?
Yeah.
And so again, we would be trying to think about what are we doing well, and what is the kind of the core curricula that are going to help us catch the most kids. And then when we see that smaller group of kids not responding, what do we do differently?
And it may not be complicated at its core, but it's hard to implement. I think it
is very hard to implement.
Simple, not easy is kind of the basic part.
And I don't mean to underplay the challenges in any way. I worked for a couple of years in my prior academic life. I consulted with a school that was among the lowest performing schools in Delaware. Mm-hmm. And the challenges were just enormous. I mean, just enormous. And so it's, it's easy for me to sit here and, glibly say you can do all of these things. But I do know how difficult it is. But I think when we think about, what's the role of the building leader, and being that person who has a good grasp on distributed leadership and empowering teachers to do the things that they know how to do well is really important, because we ask, we talk about empowering families or empowering kids, and sometimes we just sort of leave out that we need to empower teachers to be decision makers and to be the professionals that they know how to be, and to listen to them when they're telling us what they need. Is an important element.
And thank you. And a couple of questions that came up in the chat, and I'm going to work backwards on them. But the last question Debbie asked about, what do you recommend for people who have real fears about things that actually aren't to be feared right now? We've had no COVID cases in this school setting. We've contact traced, we've done everything, and yet there's still these real fears. I was in this meeting with there was an extremely large district, I won't name it, that has spent and is planning to continue to buy millions of disinfectant wipes for fomite, on risk of fomite transmission. For David, if you're on here, Lipton. Because that's what the community's fearing, is that back a year ago, everybody's concerned about sneezing and droplets. And so in hand touching, we can't share the same crayon. And so we have to wipe everything. And they know that's not the big risk right now. It was explicitly stated in the forum of peers, but they said, we got to do it anyway, because that's what makes them feel good. And that's a broad paraphrase. It's not fair to say that glibly, but it's in line with what Debbie's saying here. So much has changed. What has been considered fact has changed, and in some cases blurred. And how would you recommend it, just from a psychologist standpoint? Like how do we move out of this fearing what we shouldn't moment, and provide folks with a sense of calm and that things are getting under control?
Now, if I had the answer to that, I wouldn't need to buy a lot.
Yeah, Dr. Phil.
Yeah, well, but I do think that we live in an interesting time, and Americans are kind of interesting people. in that the politicization of a public health crisis has been kind of a fascinating thing to watch in a lot of ways, and depressing. So I think that the best that we can do is continue to provide information, to provide evidence. Here's how many days we've been in school. Here's how many infections that we haven't had. That kids are safe, that things are happening, and that. Honestly, I think it's just going to take some time for folks to gradually re-enter the world. And, I think that in terms of people demanding that we do particular things, I think, if you have a reasoned argument for what you are doing, that we are following what the CDC is asking us to do, and we're doing it in these ways. And, that again, over time, as things continue to improve, I'm hopeful that people would begin to relax and be able to, take trust a little bit more. Because I mean, really, it is a trust situation, and again, I think people have legitimate concerns. Their solutions may not be, kind of aligned with those legitimate concerns, but. Yeah, I don't think we can do much better than simply continuing to provide information, provide data, to listen to what people's concerns are, and to try to explain as best we can the decisions that we're making and the choices that we're making.
And that's the sort of basic, not easy, because how to listen, what does it take to operationalize listening, particularly to folks who who aren't going to come into your school, for fear, for these fears. And then particularly if they're more marginalized communities, that then going out to them, making these overtures and saying what you are doing and educating. Debbie's follow-up there, was it too early to stop daily health checks and temperature monitoring at the door? And that's more of a medical question, but Debbie, I can tell you from the folks that I've spoken to, large, small, many have stopped already, and citing the evidence, which is always you got to cite it, CDC, about how that's not effective.
Yeah, well, and people are often not persuaded by facts, but I think that they are often persuaded by seeing effort, seeing caring, seeing outcomes, results. And that's important. And I wanted to put a plug in again when we're thinking about how to spend money. Programs or new hires that may actually make some sense in this environment is the use of these different kinds of ways that people describe as the cultural brokers. People from the community that you are hoping to influence and hoping to reassure, having those people be trained in the messaging and those kinds of things, and using actual members of the community to talk to other members of the community is likely to be much more successful than bringing in an expert or an outsider. And so that notion of cultural liaisons or community liaisons, I think, is a helpful one.
Yeah. Okay. And Debbie, thanks for the clarification there. Knowing it's just a psychological move, is it still too early? And I think I hate to use the phrase more and more because that's usually a cop out for not having done your research, but I have heard from the folks through the webinars that we've been doing and other folks I'm talking to in districts, just that is something that has been on the wane for time and for some time now, and communicated perhaps in some of these strategies you're mentioning and can help. And even, I know districts in some states that have joined and made some joint decisions about these things, about screening, what they were and weren't going to do for screening, what they were and weren't going to do in terms of distancing on buses and cleaning on buses and those kinds of things, to do it all in unison and help. And you just noted that that's really interesting that you've been open since October and you still only have 60% of our students in person. And that's the trust, Kathleen, that you're talking about, or the lack thereof.
Yeah, well, and I do think that, again, as we're now starting to vaccinate a little bit younger, as that becomes more accepted and acceptable, and again, as people see more happening that is safe, that we're not seeing, this the whole Johnson & Johnson thing is a little bit of a
blip.
Step backwards, it's a little blip in the process, but again, I think, again, as educators, we have to, I think we just have to keep in mind that, people are doing the best that they can under very, very difficult circumstances, and they are trying to protect their most important asset, which is their children. And so, again, I think as an educator, to come at it from the perspective of, this person is working as hard as they possibly can to keep their children safe. It leads to a different set of ways that I want to interact with that person, rather than sort of seeing that person as unreasonable or unreasonably fearful or those kinds of things, that those judgments don't help us very much. And again, going back to your question about how do you listen? Well, one way that you listen is you respect where people are coming from and what their perspective is, and try to find out, again, what are they trying to accomplish with the behavior that you're finding disturbing, and that applies to adults as well as to kids. And then once we understand, what is it that this person is trying to accomplish, and that we have a shared goal of this kid being successful, that sort of helps us, again, approach problem solving from a little bit more positive mindset.
Yeah, it's certainly complex and hard to execute, maybe foundationally some key principles, but
Yeah.
details.
It's all the devil's in the details, and when there's a parent yelling, at you, in that moment, it is very difficult to keep your positive mindset and your effort to understand rather than judge. It's challenging. There's no question about that.
And we are just about at time, but I know the last question that came in is just, in the sort of the resource question of the MOUs, your don't do this alone. Extremely important. Do you have some suggestions or could you direct me and I could share some examples of effective MOU documents, frankly, that folks can poach and maybe edit and
well, the document that I shared with you, I think has some resources in it about how to get to a high quality MOU. So I think that's one good resource. I'll think about that. If I can think of some others, I'll send them along. But again, from my perspective, the main issue is, have we done that analysis to be sure that this partnership makes sense, and that it's not just somebody else knocking on the schoolhouse door and saying, "Hey, I can help you." Yeah, come on, help me. You want to be planful and mindful, and then you have to figure out how decisions are going to get made is really the bottom line, and who's going to decide what, and how, about money and about information sharing and all of those things, so that you have a roadmap. It's basically all it is a roadmap to getting an intervention or program delivered in a way that that what to do when things are not going as well as you hope.
Awesome. Okay. Well, Kathleen, thank you very much for all of your time and for saying yes to this conversation with our crew months ago, and for putting together this.
Yeah, definitely had to ask, what did I agree to? When did I agree to?
I didn't share that, but about a few weeks ago, I reached out and you said, "Who are you again? What did I agree to?"
But I'm sure I said yes, but now I don't remember what it was.
Well, appreciate you doing that, and we will put this online. We'll have it on the YouTube channel. We'll have to share this presentation. Some great links that Susan put in the chat for us. So please, everybody, thank Kathleen on your way out. Kathleen, again, thank you very much. And
you're very, very welcome.
Yeah. And we'll everybody have a great evening and look forward to seeing you next week. Take care.
Thank you.
Bye.